Hi, this is Mike Protack again, talking about national issues that affect our great state and our great country. And lo and behold, healthcare is at it again. Whether it's town hall meetings, news releases, tea parties, you name it, healthcare is out there. And at this point where we see the gradual meltdown of the Obama and the House plan, because people now are reading the bill, and in 1,000 pages there's a lot to read and a lot to not to understand right away, and once you do, people simply are not liking it. So the questions come about in a few ways. Do we need national health care? Is there a better way to do this? Well, I've always been a fan of the way of doing is have each individual state bring about a health care plan that can cover people in a universal way with private insurance. And you might say, well, why do it that way? Well, each state's a little bit different than the other. Pennsylvania is different than Delaware, which is different than Florida, which is different than Montana. Almost every state has an insurance commissioner, well trained, most of them elected to do a job. They could be the forefront of this reform effort. Most legislatures have the wherewithal to enact some sort of plan and finance it properly. The federal government works with the states right now to enact Medicaid. They do a very poor job of it, but certainly national health care, as we see the poll numbers going down, they correspond with the president's poll numbers. National health care likely will not happen. And what we see possibly is a bill that's sort of a patchwork bill that won't do much, but could end up hurting consumers. So why not take a look at what we could do at the state level? I think that's a much more productive way to go. And last year in the governor's race, we had a great plan called Delicare. Single risk pool, standardized forms and billing, and also a much more simplistic way to deal with people as human beings, as patients, and not the cash cow that most insurance companies look at people as. So how can we do this? Well, first of all, let's take a look at what doctors, what offices have to deal with. And that's something states could deal with right away. Next time you go into your doctor's office, whether it's a general practitioner or a specialist, I will assume and be pretty sure of that the doctors are outnumbered 2 or 3 to 1 by the support staff. And you might say, gosh, how's that possible? What happens is between 7 and 10% of every office practice, their costs are dealing with insurance companies. I know that's hard to believe, but when you have a state like Delaware, say you have 10 different insurance carriers, they may have 10 different coding procedures, 10 different co-pays, 10 different billing procedures, 10 different ways of dealing with the same illness, and that hurts. Doctors are wasting time on administrative matters instead of clinical matters, and that doesn't help you or me. We could do things like that to standardize issues. That's why in Delicare we offer insurance companies a chance to bid on our business so one contractor covers the whole state, and we reduce some of that administrative overload. And it's a shame that doctors have to waste their time with those sort of matters when they're trained at such a high level to deal with patient needs. And believe me, they don't want to do that in between patients making phone calls or phone calls at lunch to somebody whose job is to restrict health care. And let me make that very clear. The insurance company's job is to restrict health care access. We all know that, and we all understand that. So let's use the states, the insurance commissioners. In Delaware, we have the Delaware Health Care Commission. We can use various citizen groups to be involved to enact a plan that would work, and not the one-size-fits-all from the federal government, which a 1,018-page bill is the one we have right now to deal with, is simply not going to fly. People take a look that they took at end-of-life issues. They look at the availability to go bouncing between private and the public plan is restricted. There's a whole lot of things, once you read that bill, are not very good. And when citizens look, learn, and listen, they go to these town hall meetings and they're very upset. So let's take a look at a more localized level, something that can work, something that can be tailor-made to our individual states, and we can still put everybody in together. Again, wellness, productivity, and security can be taken a look at, and still give people choice, competition, and involve personal responsibility, and we can cover people for what we're paying now and do a whole lot better, and deliver something called value, which is what we all should be striving for. Again, national health care, I think President Obama's wrecked this thing of his own volition. The heavy-handed approach by Congress hasn't helped, but you as individuals are becoming more informed. Take a look what we can do at the state level. If you do a web search on Delicare, I think you'll see the other states. It has nothing to do with what Massachusetts has done, nothing to do with what Maine has done. It's a separate plan. but the states can do this. Because if they don't handle Medicaid right and incorporate that into a broader plan that reduces costs and increases efficiencies, the states will go bankrupt. Anyway, thanks for tuning in. Healthcare is not going to go away. It's an issue that's on the forefront now, probably for the next 3 or 4 months. Let's push for the right solution that will save all of us money, bring us better health care, and save lives. Thanks for tuning in. We'll see you later.